One of the misconceptions that women have when we start talking about hysterectomy is they become fearful that it involves removal of their ovaries. But removal of the ovaries is a separate procedure, and hysterectomy is only focused on the uterus and cervix. Another misconception that patients have about having a hysterectomy is that it might cause them to go into menopause. Again, that is only if we remove the ovaries, which we avoid unless there's some type of pathology involving the ovaries. So having a hysterectomy generally does not leave any side effects because we really only need our uterus for childbearing. Another misconception about hysterectomy is patients worry that they're going to then develop prolapse. Prolapse is when our bowels or bladder or the top of the vagina starts to fall. And because of the way we perform our hysterectomies now in a more minimally invasive way, that is much less of a problem than in the past. The majority of our hysterectomies that we perform at Women First are all done by a minimally invasive approach, which means primarily some form of laparoscopic surgery. A few surgeries will need to be done in an open manner, which is then considered no longer minimally invasive. Sometimes it seems that the media makes patients think hysterectomy is a bad word, but having that procedure done, many women need it to improve their quality of life. And really the uterus serves no function for us after we're done having children. So the only reason to technically retain your uterus is if you're going to want to become pregnant. So we hope that we can talk through that process with patients and make them understand that for some people that's their only option based on the problem that they have. And in my clinical experience, I'd say 99.9% of my patients later tell me, "This was the best thing I ever did. I'm so glad I did this. I wish I had done it sooner."